4 Charlie Delta, traffic's at your 2 o'clock and 2 miles still eastbound. Copy that now.
Welcome to our 6th edition of Volair Views. I'm Jack Penning. This week we're going to talk about what it's going to take to get people traveling again. But first I want to remind you, we couldn't do these videos without the support and production of Alex Lynch at Gen XI Productions. We start this week with new statistics from the U.S. Travel Association. In a typical week, at the end of April, we'd see about $20 billion in total travel spend. Last week, passengers spent only $2.5 billion. That's about 10% of what we would normally expect. It was the worst week so far, and the curve is still trending downward. So while it feels like we may have hit the bottom at our airports, passengers are stable at a very low number. Spend is still going down. So everybody's talking about how do we get people to travel again, and our thought at Volair is people need to feel safe. So how do we make people feel safe in the air? Well, Delta CEO Ed Bastian had the idea last week, and we've heard this from other people, that those who have had COVID-19 should have an immunity passport that essentially says that they are free of infection and that they won't be infected again. That would prove the traveler had recovered. The theory is that they're immune. We don't have proof of that yet, but it is probable. But it brings up an interesting moral dilemma, at least in my mind. Those with immunity get to travel. Those who don't have immunity have to stay home. In our business, or any business where you have to travel in order to make a living, how do those who don't have passports continue to go about doing their job? Many have written, and we've seen it over the weekend, that they would intentionally contract the disease in order to recover and get the passport so that they could travel again. Most would recover, let's be clear, but even healthy younger people have died from COVID-19. So certainly a subset would face serious medical consequences. So an immunity passport, in my mind, could cause more harm than good because it could put people into our hospital system who otherwise would be healthy.
If you have 40 cards, A1 through 30.
Another idea is that every passenger should be tested either before their flight or when they arrive in a new country. But we don't have enough tests right now that even those with symptoms can get tested. So how do we scale up to a level where we can have enough tests that the millions of people who travel every single day will be able to be tested at multiple points along their journey? And what about false positives and false negatives? Also, temperature checks. Some countries doing temperature checks when people arrive, China one of them. That seems somewhat pointless to me, at least, because a large proportion of those who have the disease have no fever whatsoever. And the average incubation period is 5 days. So that means you have a 5-day period where you won't have a fever even if you manifest symptoms later. So that brings us to social distance. It's what we've all been doing for these many weeks. Airlines have started to socially distance in the air. They're blocking middle seats in most cases. In some regional jets, a pair of 2 seats, 1 seat is blocked. But let's be honest, you're still a lot closer than 6 feet from your neighbor. The average seat width is 18 inches. That's 1.5 feet. So social distance is only going to do so much. Also, margins for airlines in good times are between 5 and 10%. So you remove a third of the seats, what happens to margin? Well, the best case is you lose 15% on every dollar that you spend transporting somebody. So that's definitely not a long-term solution. There are those that say the only surefire way to make people feel safe in the air is for a vaccine to be available. That would ensure everyone who has the vaccine is immune and that the disease cannot be transmitted, but that would mean a very long period with virtually no travel. I mean, maybe 12 months, 18 months. The SARS pandemic happened in 2003. There's still not a vaccination today, 17 years later. That is possible with this. If we wait that long, there probably will not be any airlines left. So it's our thought that we need to be pragmatic. We need to ensure that there's as little contact between people as possible and keep people as safe as possible. We need TSA to look more like Clear, where you have an iris scan and you don't have to touch anything when you're going through security. The reality is, on board, we probably need everyone to wear a mask. Canada has already gone that way. Air Canada is requiring everyone to wear a mask on board. It's not foolproof, but some new research that we're seeing shows it cuts infection rates by 99%, just a simple homemade cloth mask. If people feel safe, and there's statistics like that show us wearing a mask will make you safe, people will do things like that to be pragmatic and travel. But we're going to need clear direction from our industry and from our governments in order to make people feel like getting on a plane is the right thing to do. That's it for this week. We will talk to you again soon, and stay safe.